It is absolutely top of my list. I think this is the single most important priority facing the NHS at the moment, because we've had these terrible tragedies at Midstaffs, at Morecambe Bay, at a number of other hospitals. And people rightly want to know that their local hospital is delivering healthcare to the highest standards. Where you have a really entrenched failure, it's not something that you can turn around overnight. But I also want to be positive and say that I expect the public to notice changes in their local hospital within a matter of months. So we're not hanging around and we're publishing the turnaround plans. I'm going to be reporting back to the public every quarter. I am accountable as Secretary of State for making sure that all our hospitals in the NHS are safe. But I've concluded that the best way to do that is to tap into the inspirational leadership of people like Dame Julie Moore at University Hospitals Birmingham, one of the best IT systems in the world in that hospital. People like David Dalton at Salford Royal, one of the safest hospitals in the world. And I think if we tap into those skills, if we properly have a contract with those hospitals and say, look, we are formally asking you to help us turn around this struggling hospital, I think we're going to get results in a way we haven't before. It's fair to say that successful hospitals are really enthusiastic to help turn around other hospitals in difficulties. And I think we've learned from the education system that, whilst this can be a challenge, actually most of the time the superheads have been very successful at turning around a failing school, but also making sure their own school maintain the highest standards.